This is a case of multiple lipoma. You can see many lipomas. This is one big lipoma. This is another big lipoma for him. These are another small lipomas. कब से हैं आपके ये lipomas?
ज़्यादा नहीं।
ज़्यादा दिन मतलब कितने टाइम से आपने पहली बार नोटिस किए थे? क्या क्या ट्रीटमेंट किया आपने इसका? 10-12 साल से है। और ट्रीटमेंट क्या किया आपने इसका?
होम्योपैथिक दवाई।
हाँ जी,
होम्योपैथिक
दवाई खाई थी। क्या दवाई थी, नाम याद है कुछ?
नहीं।
कितना टाइम होम्योपैथी दवाई खाई?
2-3 साल।
3 साल खाई। ओके, तो होम्योपैथी से कुछ कम हो गया कि बढ़ गया?
कुछ कम नहीं हुआ, बढ़ते गए।
होम्योपैथी के बाद बढ़ गया ये? ओके, पहले छोटे थे फिर बढ़ते गए। ओके, और कोई भी इलाज किया था इसके अलावा?
अंग्रेजी दवाई भी खाया था लेकिन उससे भी कुछ
नहीं हुआ। तो जब होम्योपैथी से इलाज नहीं हुआ तो फिर आपने उनसे पूछा कि ये दवाई खाई है मैंने, कुछ हो नहीं रहा?
हाँ, कुछ और टाइम लगेगा।
कितना टाइम बोला था उन्होंने? शुरू में कितना टाइम बोला था?
वो कुछ ऐसा नहीं बताया, बस बोलता था टाइम लगेगा, ठीक है।
तो फिर दवाई से कुछ कम भी नहीं हुआ?
नहीं।
ओके,
फिर छोड़ दिया दवाई।
2 साल खाया कि उससे भी ज़्यादा खाया?
2 साल तक खाया।
2 साल तक he has taken homeopathy medicine for 2 years, and when he was visiting his doctor they were telling that no, you keep on taking, maybe sometime in your life, maybe 10 year 20 year, or don't know when this will become okay. After 2 years of taking medicine he stopped medicine, and rather than getting decreasing in size, they increased in size after taking the medication. So he became more worried. So now he decided that he will not do further medication for this. He has tried allopathic medicine also. And allopathic में कौन सी मेडिसिन है? एलोपैथी there is no medicine, कोई मेडिसिन नहीं है एलोपैथी में। तो क्या मेडिसिन खाई थी आपने? एलोपैथी की क्या मेडिसिन खाई थी इसके लिए? एलोपैथी में कोई मेडिसिन नहीं है। there is no medicine in allopathy for this. Only treatment is removal, or there are some injections available which I don't recommend because they cause more damage than the good. So whenever there are lipomas, if there is side fat or just fat, that can be dissolved with the help of lipolytic injections, but otherwise there is no medicine in allopathy for lipoma. And when there are lipomas, it is never recommended to use any lipolytic injections. So this is common practice that the local doctor or so-called doctors will start giving medication for this type of saying that with this medicine this will decrease. Patient keeps on taking medicine of over years and without any relief, and then they start getting depressed also. I have treated many patients who had developed reactions because of taking medication. I have treated many patients who tried herbal patches there and the whole skin went wrong. They had tried different type of burn techniques also, which leads to more scarring and more discomfort. So at present at least there is no available medication for this type of lipomas. We must, if you are bothered with lipomas, do a surgery. For small lipomas definitely you can ignore them, but some lipomas like this lipoma, initially also we have done a very big lipoma in this region which was almost the size of a small football, and you can again see this is another lipoma which has become quite big. If we leave it like this can cause pressure symptoms, this will cause weakness of the arms, and definitely it is cosmetically it is ugly looking, and not only this is a cosmetic problem, this causes a lot of social and psychological problem to the patient because of this. So whenever these patients get relieved with this lipoma, their faces changes actually. They have never thought that this can go so easily. The technique developed by us is very helpful for the patients, and most of the patients can come, get it done and go same day within 1 or 2 hours. And some patients who have plenty of lipomas, they require admission, a day stay in the hospital, and next day they are fit and fine, and they can drive, they can sit, they can do almost all activities. We don't recommend gymming immediately after the treatment. Most of the patients we recommend at least 1 week or 10 days of restriction from heavy activities. But normal activities, driving, sitting, writing, they can perform from the next day only, or rather same day also. So if this patient has come driving, he will go he can drive back himself also.
So as we are seeing, this is very big in size, this one lipoma. So is it possible this can cause problem to the surrounding structure, blood
Yeah,
vessels
definitely
or
this
joints?
causes problem to the surrounding structure and the joints and the surrounding vessels also. As the lipomas grow, they cause pressure symptoms, and they can cause blockage of the distal vessels. They can cause compression symptoms on the nerves, and many times they cause indentation on the bone and the muscles, creating a gap there. And definitely restriction in the movement is another issue. And another issue for this type of patient is, if these keep on growing fast, there is a possibility of cancer developing in them, so they must be removed well in time.
Okay, sir. Thank you, sir.